The secret in your nails. That doctors check first. When a doctor shakes your hand, we're not judging your manicure. We're quietly reading early clues. How is your blood flow? Are you getting enough oxygen? Has your body been under stress recently? Are you hydrated? Is your nutrition steady? Your nails are like a little diary of the last few months. Tonight we'll look at 7 signs doctors check first, step-by-step ways to examine your nails at home, and gentle actions you can take, without fear. We'll separate regular age-related changes from genuine red flags so that you can feel informed, not alarmed. Keep a kind mindset. Your nails aren't trying to scare you. They're offering whispers you can use to stay strong, independent, and well. Main content. Color and energy in the nail bed. What pink versus pale can whisper. How to check at home. Sit comfortably with your hand at heart level. Press the tip of one nail until it turns white, then release. Count. 1, 2. It should return to pink in about 2 seconds. Compare 2 or 3 nails. Then look at the overall nail bed color under natural light. What it might mean: soft pink, usually a sign of healthy blood flow. Persistently pale can hint at low red blood cells or low iron, especially if you feel tired, lightheaded, or short of breath. Bluish/grayish may reflect lower oxygen levels or cold hands from reduced circulation. Warming and movement should help. Very red/beefy sometimes appears with irritation or inflammation. Harsh chemicals, frequent sanitizers. Story: Tom in Ohio. Tom noticed his nails looked paler in recent photos, and he was winded on hills. A simple blood test showed low iron. With lean meats, beans, spinach, and vitamin C to help absorption, and guidance from his clinician, his energy and nail color improved within weeks. Gentle actions. Pale nails plus fatigue or breathlessness. Ask about a blood count and iron studies. Blue tint that doesn't improve with warmth and gentle movement. Mention it promptly. Everyday supports. Steady hydration. Hand warmth in cool weather. Protective gloves for cleaning, and a mild hand lotion after washing. Reassurance versus red flag. Reassurance. Brief paleness. After dishwashing on a cold day that resolves with warming. Red flag. Persistent paleness with dizziness, blue tones, and new chest tightness. Seek timely care. Shape and curve. Flat, spooned, or bulb-like. How to check. Turn your hand sideways at eye level. Do nails gently follow the curve of your finger, or do they scoop, flatten, or curve over the fingertip? Compare to older photos if you have them. What it might mean. Spoon-shaped, thin, scooped. Can be linked to low iron or nutrition issues. Clubbing, rounder fingertips, nails curve over. Can be associated with long-term lower oxygen levels and sometimes heart or lung conditions. It evolves, so trends matter more than a single day. Story: Margaret in Yorkshire. A lifelong knitter, Margaret noticed her fingertips slowly rounding. Mentioning it led to a review of her walking breathlessness. A small plan, daily strolls, inhaler check, light strength work, improved her stamina. Over months, her fingertips looked less rounded, and she felt safer on hills. Gentle actions. Take 2 side view photos a month apart. Compare calmly. New spooning or progressive rounding, especially with breathlessness, cough, or fatigue, deserves a check-in. Avoid pressing, prying, or over-trimming that can distort the shape. Reassurance versus red flag. Reassurance. Slight flattening with age, but no symptoms. Red flag. Clearly increasing rounding plus reduced exercise tolerance. Ridges and lines. Your body's timeline. How to check. Under good light, tilt each nail to see the texture. Vertical ridges run from the cuticle to the tip. Horizontal grooves run across the nail. What it might mean. Vertical ridges are very common after 50, like gentle tree rings, and often harmless if nails are strong. Horizontal grooves, pause lines, can appear after illness, high fever, surgery, grief, or other stress. Your body temporarily redirects resources to heal. As nails grow, the lines move outward. Story, Nora in Melbourne. After a hard flu, Nora noticed faint grooves a month later. Her doctor called them recovery marks. With rest, balanced meals, and fluids, the lines grew out and vanished. Gentle actions. Nightly moisture. A pea-sized amount of hand cream plus a drop of oil on each nail and cuticle. Nutrition foundations. Protein with each meal. Leafy greens. Omega-3s from fish, walnuts, or flax. If horizontal grooves keep returning, or you notice weight loss, night sweats, or profound fatigue, share the pattern with your clinician. Myth versus fact. Myth. Any ridge means disease. Fact. Most vertical ridges are regular with age. We always pair nail findings with how you feel. Texture and thickness. Brittle, peeling, or thick and yellow. How to check. Feel the surface. Is it smooth, flaky, or splitting at the ends? Do nails peel in thin layers? Are any thicker, yellowish, or lifting from the bed? What it might mean. Brittle paste peeling, common after 50, linked to frequent hand washing, cleaners, dry climate, or strong removers. Often improves with moisture and protection. Thick, yellowish nails can suggest a slow-growing fungal infection, common and treatable, but requires patience. Rarely, very thick yellow nails appear with leg swelling or long-standing breathing issues. Story. Edwin in Arizona. His big toenail thickened and yellowed. A clinician confirmed the fungus. With careful trimming, foot hygiene, and a treatment plan, he saw new, clear growth over months and felt comfortable wearing sandals again. Gentle actions. Gloves for chores. Moisturize after washing. Avoid ripping or biting. Keep nails short and straight across. Smooth edges with a soft file. Thick, yellow, or lifting nails, or several changing at once, deserve a check. Toenails grow slowly. Celebrate minor improvements. Practical foot care. Rotate shoes so they dry thoroughly. Wear breathable socks. Choose a toe box room to avoid trauma. Wipe between toes after showers. Dry well before socks go on. Spots, streaks, and specks when a mark matters. How to check. Scan each nail tip to base under a bright light. Note tiny red-brown splinters, white dots, or any new dark vertical streak. Photograph unusual marks with today's date. What it might mean? Tiny red-brown lines, often from small bumps. If they recur and you feel unwell, fever, chills, get checked. White dots, slash patches, usually from minor knocks. They typically grow out. A single new dark vertical streak, especially widening, with uneven edges or darkening skin at the cuticle, needs prompt review. Many are harmless pigment changes, but early attention is wise. Story: Lila in Cornwall. She noticed a slim brown line on her thumbnail that darkened slowly. Her GP referred her quickly. It was a benign pigment change. The relief she felt came from asking early. Gentle actions. Monthly photos help you track change calmly. Any widening or color shift, especially with skin change around the nail, deserves a timely appointment. Don't scrape or drill a spot. Let a professional look first. Reassurance versus red flag. Reassurance. Small white specks that move outward with growth. Red flag. A new, changing dark streak in one nail. The cuticle and the moon. Your nail's safety seal. How to check. Look at the base of each nail. Is the cuticle intact or sore and ragged? Do you see a pale half moon? Lunula? Its size varies by person and finger and isn't a test. What it might mean? Sore, puffy cuticles, often from cutting, picking, or dryness. That tiny rim is your natural seal. Removing it makes infections easier. Lunula changes very naturally. Sudden shifts alongside symptoms may be one more clue, but they are never used alone. Story: George in Florida. He clipped his cuticles for a clean look. 2 fingers became red and tender. A nurse showed him a safer routine. No cutting, just gentle moisture and leaving the seal alone. Redness settled in days, and growth smoothed out. Gentle actions. Do not cut or tear cuticles. After washing, pat dry and apply a drop of oil around the nail fold. If a cuticle turns painful, hot, or oozes, seek care early. Minor infections are far easier to treat. For salon visits, ask for clean tools and skip aggressive cuticle trimming. 2-minute nightly routine. Rinse hands warm. Pat dry. Put pea-sized lotion over hands. Put 1 drop of oil per nail and slowly circle massage around the cuticle. Over weeks, there will be fewer splits, smoother edges, and more comfortable hands. The whole person view. Nails plus how you feel. Nails give clues. Your story provides meaning. Doctors never diagnose by nails alone. We pair what we see with how you feel. Are you short of breath on stairs? More tired than usual? Losing weight without trying? Do you have new swelling in your legs? Are your fingers or toes often icy? Story: Sam in Seattle. Sam noticed paler nails and needed more breaks on his daily walk. At a checkup, one medication was adjusted. He added a protein-rich breakfast and light strength training. A month later, his stamina improved, and so did his nail color. Gentle actions. Make a nail and energy note once a month. Color, any lines or spots, breathlessness, walking distance, sleep quality. Patterns guide competent care. Foundations. Protein at each meal, steady hydration, movement you enjoy. Walking, gentle resistance, Tai Chi, and consistent sleep. No urgent signs. Sudden blue nails with breathlessness, chest pain, a finger that turns very painful and purple, or fever with a red throbbing nail fold. Seek prompt care. Everyday toolkit. Low cost and straightforward. Rounded clippers, soft file, cotton gloves for chores, unscented lotion, a small bottle of plain oil, olive, jojoba, almond, breathable socks, and your phone for monthly photos. Toe safety. Shoes with wiggle room. Trim straight across. Smooth, sharp corners gently. 3 small habits that help nails grow better. A glass of water with each meal and 1 between meals. Protein at breakfast. Eggs, Greek yogurt, tofu scramble, cottage cheese, nut butter on whole grain toast. 10 minutes of hand-friendly movement daily. Squeezing a soft ball, gentle wrist circles, and a short walk to boost circulation. Myths we can let go. White spots always mean a vitamin deficiency. Most are little bump marks that grow out. Hard acrylics make nails healthier. Over-hardening and harsh removers can lead to brittleness. If one nail looks odd, it's nothing. Single nail changes are precisely the ones to watch and photograph. Small Q and A. Quick reassurance. Do nails show every disease? Number. Nails are clues, not verdicts. We always consider the whole person. How fast do nails change? Fingernails grow about 3 to 4 millimeters a month. Toenails grow more slowly. Expect improvements over weeks to months, not days. Look at your hands tonight. These hands have stirred soup, tied shoelaces, planted tomatoes, typed notes to friends, and held the people you love. Your nails are part of that story. Gentle signals, not sirens. Which sign surprised you most today? Did you see yourself in Tom, Margaret, Nora, Lila, George, or Sam? Tell me in the comments. What did you notice in your nails, and what kind of step will you take this week? Moisturizing, a photo log, a protein-rich breakfast, or booking a friendly checkup. If this felt helpful, please like, subscribe, and share it with someone who'd appreciate calm, practical guidance. Your support keeps this caring community strong, steady, and independent. Be kind to your hands. They've carried you far and still have miles of good left to go.